Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest trends and interesting stories in health IT. On today's episode, we're going to be talking about interoperability with a company that you probably don't normally associate with interoperability in healthcare. I'm here with Justin McMartin, Product Manager at Surescripts. Justin, welcome to the program.
Yeah, thank you so much for having me.
So right off the top, Surescripts is not the company I think about when I hear the words interoperability, but you were telling me before I really should be. Tell me why.
I'm out here trying to change everybody's thinking on that. So my specific role at Surescripts is focusing in on how we can expand the ways that we can leverage our network. So primary products I work with are clinical direct messaging, where we're sending over 20 to 30 million transactions every month with clinical direct messaging. We're also working in our record locator and exchange in the care quality framework, exchanging millions of clinical documents every month again, to the point of where we exchanged over 1.2 billion clinical documents in 2022. So we're an interoperability company, and it's really everything we do. Even electronic prescribing, when we think about it, is probably something that was termed as interoperability before we solved that problem, right? And so we want to make sure that everybody knows that Surescripts is very much in the interoperability space.
Yeah, I mean, I gotta be honest, like most people think of you in the e-prescribing space, right?
Absolutely.
Which you do own, and everyone knows you for that. But like you said, these other records, these other formats, you also have billions of them traveling through your platforms.
Absolutely, yeah, and it's not just other clinical data. We obviously are doing other benefit information or other things like that get exchanged across our network every day, and the hundreds of millions of transactions.
Now you mentioned Direct Trust. You're sending direct messages through there. What's the volume? Do you know what the volume is of that?
I don't remember off the top of my head exactly what it is, but we're sending millions of transactions in that space. One of the things that we're really excited about is that some of the roles that we played during the pandemic. So, for example, all of the immunizations that were occurring, the COVID vaccines that were being provided, sending those electronically from our pharmacy partners into healthcare providers to make sure that they knew their patients had those, and we sent over 10 million of those in 2022. And continue to see millions of those types of interactions happening and sending electronically. Additionally, electronic case reporting, so where the COVID cases were occurring and how those are being tracked by public health agencies. Using our direct messaging network to send that through our partners was another significant thing. We're sending millions of those transactions, and still today are doing that as well.
Well, as evidence of how serious you want to be considered as an interoperability play, you have an announcement that you're making here at HIMSS that you have your intent for the QHIN designations.
Yes.
Tell me more about that.
Thanks for asking, Colin. I've been a little bit busy this week talking about that. So Surescripts obviously has been paying very close attention to everything that's going on, with the Trusted Exchange Framework and Common Agreement. We've been longtime partners with the Sequoia group. We've also, obviously been working with them in terms of the care quality work that we do with our record locator and exchange product. And, we've just seen a lot of really great progress, a lot of excitement around it. And we think it was the right time for us to say, this is the right time for us to apply. And so we released our press release on Monday to say, that we intend to put that application in. And so we're very excited to start working with Sequoia in this way as the recognized coordinating entity, and to get on our way and pursuing that role as a qualified health information network.
And what are you hoping that people will use your network for?
Yeah. I think that obviously the goal and intent of the Trust Exchange Framework has always been something we've supported.
Okay.
Obviously wanting to see a more consistent, efficient way that information is exchanged across healthcare is critical, right? That's one of the things that we want to make sure that we can realize and understand, understand, but realize the true value of what interoperability brings to the healthcare network. And without an efficient way of doing that, the vision that QHIN brings to it, we might not be able to do that. And so I think that's really where we want to drive our involvement there. Is to just find ways to be more efficient, to work with our customers and our partners in the Network Alliance.
Sounds like you're going to have a fun few months ahead of you as you spin up your QHIN.
Oh, very much so. I'm gonna be very busy. Thanks for reminding me.
Yeah, no.
I'm already exhausted from hymns, and then now you're
adding more work for you.
Get all that paperwork done that you're supposed to be working on while I'm talking to you, Colin.
Get on it, Justin. Get on it. No, this has been great. Thanks for sharing all this great information.
Yeah.
Where can people go to find more information about Surescripts?
Yeah, so I mean, obviously, Surescripts.com would be a great place to go. If you're here at HIMSS, stop by our booth, 1851 here on the show floor. Excellent.
Justin, thank you so much for being on the program.
Yeah, thanks for having me.
Hey, if you enjoyed this interview as much as I did, we'd love for you to head over to healthcareittoday.com for more content just like this. I'm Colin Hung. We'll catch you on the next one.